So a 25-year-old young lad presents to my OPD with the pain in his hip, thigh and knee and difficulty walking with significant limp. On detailed history, he was affected with COVID and he was on steroids for a reasonable time period, which is a cause of this problem, which is also called as a avascular necrosis, wherein the blood supply of this blood supply to the hip joint is deteriorated because of the steroid consumption, and the head started to collapse. So on examination, he had restricted movements around the hip and was not able to walk normally, and he was having pain in his hip. The other thing to note is most of these patients can present with mainly knee pain, and they will be thinking about that this is all coming from the knee. But when we evaluate, we always look into the hip joint, and most of the time it is the hip which is the culprit than the knee. And on further evaluation with X-rays and MRI scan had shown the deformity of his ball of the head, which means it has collapsed and also started to develop arthritis. Unfortunately, this has reached the last stage of the avascular necrosis. In the initial stages, we can still preserve the hip joint, but when it comes to this stage where the head has deformed and collapsed and started developing arthritis, the only way to manage this would be to offer them a total hip replacement.